Hello, my name is Frank Puig. The following 20 slides combine parts 5 and 6, which I call takeaways, of an 8-part presentation that attempts to provide for average Americans a persuasive response to the persistent question of how will we pay for a Medicare for all single-payer health system for our country. Full disclosure, I offer it as an unwavering citizen advocate for Medicare for all's eventual enactment. It's based on analyses of the former House Bill H.R. 676, the Expanded and Improved Medicare for All Act, performed by Dr. Gerald Friedman, and Bernie Sanders' Senate Bill S. 1804, the Medicare for All Act, performed by Perry, the Public Economic Research Institute. Both Dr. Friedman and Perry are located at the University of Massachusetts at Amherst. However, it does not contain any financial analysis of the new House Bill H.R. 1384, the Medicare for All Act of 2019, introduced by Representative Pramila Jayapal on Wednesday, February 27th. As envisioned, Medicare for All would provide comprehensive health care for all residents of the United States, commencing at birth, while producing a significant reduction in health-related expenses for at least 80% of our population. Businesses would also realize measurable savings in their health-related expenses, which will benefit their bottom line. The necessary foundation of the presentation is that there must be a broad-based, nonpartisan, red-blue core understanding that the economic gains of the last 40 years have overwhelmingly gone to the very top income and wealth strata of our society, and that shared prosperity has been a fiction. So let's start. Takeaway number 5. A Medicare for all single-payer health system providing robust health insurance coverage from the womb to the tomb for all residents in the United States is clearly financially feasible. So how much will it cost? Dr. Friedman projects the annual cost of a full Medicare for all program as if it was fully operational this year at approximately $2.9 trillion. This total cost incorporates an approximate savings of $1 trillion from our current inefficient and profit-driven non-system, which in 2018 cost $3.63 trillion. Remember that full Medicare for all means that everyone will have access to comprehensive health care, including more than 30 million uninsured and 85 million underinsured Americans without the need for deductibles, co-pays, co-insurance, or premiums. Friedman maintains the existing public revenue of approximately $2 trillion currently dedicated to healthcare, leaving a financial need of approximately $900 billion. Where does Friedman find $1 trillion in savings in our present non-system? He estimates $649 billion in savings from allowing Medicare to negotiate drug, medical device, and hospital prices for us. He estimates $258 billion in savings in unneeded private health insurance administration, the middleman that provides no added value. Medicare's administrative cost is less than 2% as opposed to private health insurance administrative cost estimates, which range from 17 to 20%. Finally, Friedman estimates savings of $192 billion in provider billing and insurance activities. Think of all the personnel behind the desks of doctors' offices, clinics, and hospitals, sometimes looking like a small army, that check your specific health insurance carrier, coverage and benefits, and your cost-sharing obligations, such as co-pays or deductibles. As I stated before, Friedman's analysis projects a total 2019 Medicare for All budget of approximately $2.9 trillion after incorporating the $1 trillion in projected savings made possible by Medicare for All's implementation. Friedman, as other studies have done, maintains the current public commitment to health care. All existing revenue from Medicare, Medicaid, and CHIP, the Affordable Care Act subsidies, the tax subsidies that offset the revenue lost through the deductibility of employer health insurance premiums, the Veterans Administration, and active military health care costs, as well as other federal and state health care programs, would all be combined, adding up to approximately $2 trillion. That leaves the need for new revenue, at $900 billion. So what about the Senate bill S-1804? How much do researchers think it will cost? Let's find out by turning to the Public Economic Research Institute's analysis of S-1804, the Medicare for All Act. Interestingly, the Perry team sets the total healthcare expenses of 2017 at $3.63 trillion, nearly identical to Friedman's projected total costs of $3.6 trillion for 2019. Again, this is without the savings that would occur through implementing Medicare for All. And the Perry team's analysis comes up with approximately $700 billion in savings as opposed to Friedman's estimate of $900 billion. Noteworthy is Perry's addition of a savings category, lowering fraud and waste. The Perry study also combines and maintains all existing government revenue devoted to health and sets that at approximately $1.9 trillion as opposed to Friedman's $2 trillion. The difference in base years, Friedman's 2019 versus Perry's 2017, may account for the difference. But here's the beautiful thing. Both Friedman and Perry are remarkably close in their projected total cost of Medicare for All, approximately $2.9 trillion, and in the total amount of new revenue needed, between $900 billion and $1 trillion. So the bottom line is that we need to raise between $900 billion to $1 trillion. Given the closeness of the findings of the Friedman and Perry studies, it can, I think, be safely assumed that the numbers will be in the same ballpark for the new Medicare for All Act of 2019, H.R. 1384. So how do we pay for Medicare for All and join the rest of the developed world in recognizing health care as a right? That's the question that too often goes unanswered. Which brings me to takeaway number 6. Don't allow any elected official to tell you that a program or policy goal, such as Medicare for All, is financially unfeasible or too costly without asking, indeed demanding, that they share the analyses that they are basing their conclusion on so that you can study it with people or organizations to help you if need be. And please note, budgeting is the allocation of financial resources to achieve desired program or policy goals. It is not rocket science. What you will see on the next 2 slides is a listing of the various revenue proposals that have been suggested in the Friedman and Perry studies, and from Bernie Sanders' options for funding Medicare for All. I add a couple of my own suggestions. The list is divided into 6 categories. The first 4 categories, as you will see, produce over $1.6 trillion in new revenue, $600 billion more than the $1 trillion Perry estimate of new revenue needed. The first category, the wealthy pay their fair share, is simply acknowledging what I said at the beginning of this presentation, and that is that the economic gains of the last 40 years have overwhelmingly gone to the top income and wealth strata of our society, causing a level of income and wealth inequality not seen since the Gilded Age. It is not unreasonable to ask of them that they pay their fair share. This category includes more progressive income and estate tax, a wealth tax, and closing the myriad tax loopholes available to wealthy business owners. Category 2, Wall Street firms and large corporations pay their fair share, includes taxing offshore profits, a fee on large financial institutions, closing accounting loopholes, and corporate tax reform to close the host of rebates, subsidies, and industry tax breaks that significantly lower the nominal corporate tax rate of 21%. Category 3 includes the so-called Robin Hood tax on stock and bond transactions, and the Perry suggestions of an 8% employer health premium and sales tax on non-essentials such as food, shelter, and utilities. I've added Category 4, government waste, and give as an example the $125 billion in administrative waste found in the Defense Department by its own internal audit conducted in 2015. So here's the point. We have managed to raise over $600 billion, more than the $1 trillion the Perry study said we would need to make Medicare for all a reality. And we did this while still relieving Americans of having to deal with forms, constant changes to insurance policies designed to improve profits, not health, and without premiums, deductibles, or copays that too often make seeking care a non-starter. And we dramatically improved the monthly cash flow of the great majority of Americans and business owners. How did we do this? We did this by replacing the fiscal unfairness of the last 40 years with tax policies that are driven by a vision of the United States that is just, fair, and humane. So what do we need now? Simple, the political will to do it. But what if there are other societal priorities that desperately need revenue, such as investments in infrastructure or alternative energy sources to combat climate change, universal pre-K or guaranteed college education, universal child care or workforce development? Well, then we might use a payroll levy on employers and households or some level of cost sharing, but with the caveat that the use of either must achieve a substantial reduction in healthcare expenses for the great majority of our nation's citizens, eligible residents, and business owners. Now let's look at one potential funding source, which I call the real skinny on corporate taxes. As this chart shows, corporate taxes as a percentage of federal revenue dropped like the proverbial ton of bricks from 32.1% in 1952 to a projected 7% this year, while personal income taxes and Social Security taxes increased dramatically. Remember that Social Security has a wage cap on which taxes are assessed, making it extremely regressive. No Social Security are withheld this year after $132,900. Notice also that excise taxes, that is, taxes on items such as alcohol, cigarettes, and gambling, also dropped significantly. So let's delve more deeply into the corporate tax story and its lost potential to provide revenue for programs supported by the great majority of Americans like Medicare for all. The potential. Over the 2008-2015 period, 258 consistently profitable corporations, I repeat, consistently profitable corporations, earned more than $3.8 trillion in pre-tax profits. Had all of those profits been reported to the IRS and taxed at the statutory 35% corporate tax rate, the 258 corporations would have paid $1.3 trillion in corporate income taxes over the 8 years. In turn, the $1.3 trillion could have provided over $160 billion per year towards Medicare for all. Unfortunately, the story of our so-called non-competitive corporate tax rate has been one of the biggest political scams perpetrated on Americans. Of the group of 258, 18 of the corporations, including General Electric, International Paper, Priceline.com, and PG&E, paid no federal income tax at all over the 8-year period. A fifth of the corporations, 48 of them, paid an effective tax rate of less than 10% over that period, and effectively exposing the myth that our corporate tax rate was not competitive with the rest of the world. Of those corporations in the sample with significant offshore profits, more than half paid higher corporate tax rates to foreign governments where they operate than they paid in the United States on their U.S. profits. Now let's look at the current poster child for this travesty. Amazon, which as of Sunday, March 3rd, this past Sunday, had the world's third largest market cap and whose owner, Jeff Bezos, is the richest person in the world, paid zero federal corporate income taxes last year and the year before. Zero. Medicare for all is too costly? No, not really. What is too costly is continuing to elect representatives that couldn't care less about you, your children, and your grandchildren. John Adams, our second president, in letters to Thomas Jefferson, over 200 years ago, lamented, "To me it appears that there have been party differences from the first establishment of governments to the present day. Everyone takes his side in favor of the many or the few." And caring about the earliest citizens of our country, he wrote, "How can we free ourselves from illusions about the free market in order to assume a more equitable distribution of wealth?" President Lyndon Baines Johnson signed H.R. 6675, the Social Security Amendments of 1965, establishing Medicare, on July 30th, 1965. Who will sign the Medicare for All into law in 2020?